In this exercise, we're going to test your skills when you drill into a bone. Because when you drill through a bone, you're going to go into soft tissue also. And this depends on the amount of sensitivity that you have while drilling, but it also depends on the technical advantages of your drill related to sharpness of the drill or bluntness of the drill. And you will find that if you use a blunt drill, this is much more difficult and much more damaging to the soft tissue than if you use a sharp drill. The instruments we have for this is a drill, and we have different drill bits. This is a 4.5 drill bit, and it is applied to the machine by pushing up on this little knob, turning the drill until it lodges. Now you can use it. I will demonstrate it without actually going through the bone. Here you see a generic bone, and you see this little contraption in the back. Now this is plasticine. It is very soft, and this is supposed to represent your soft tissue on the other side of the bone. So I want you to apply the drill to the bone, push down the sleeve and hold the sleeve, and then drill through the first cortex, go to the next cortex, drill through the next cortex without touching the drill sleeve. Maybe you can hold the bone like this until you have the feeling that you've gone through the transcortex. Now when you drill, there are some things you have to watch. You have to be able to really control your drill bit in the direction that you want to go. So this would be wrong, and this would be wrong. This is more or less in continuation of your arm. And it is always good to try to stabilize the drill by having some contact with the leg or the arm. I will do this by just touching the generic bone and holding my drill sleeve here. And then I go all the way through, and I would like for you to do this now. This is a sharp drill bit. Okay, make sure you have centered it so that when you go through, you will hit the other side of the bone. Okay. Then stop. Now let go of this. Hold this. Now slowly advance your drill until you have the feeling that you have drilled through the transcortex. And then stop. Okay, hold it. Now give this to me. You see, you have red substance on the drill, meaning that you have touched the soft tissue. Let's see how far you went into the soft tissue. There you are. You penetrated about 3 to 4 millimeters, which is absolutely acceptable. If you go further, you know there are arteries, there are nerves, so there is tissue that should not be damaged. So let's try the same thing with a blunt drill. Now I would like for you to take the drill bit and put it into the drill, like I showed you before. Okay, now apply the drill to the generic bone. Okay, put down the sleeve and hold it and start drilling. Now stop. Let go of the drill sleeve. Hold on to this, and now drill through the transcortex. And then stop. Okay. Now let us measure the amount of soft tissue penetration this time. It went in about 2 centimeters, meaning that you've wrapped a nerve around the drill. So now you see the difference between a blunt drill bit and a sharp drill bit. And how can you tell if it is blunt or if it's sharp just by looking at it? Let me show you. These are the two drill bits. If you look at the points, you see a difference? You see the light reflecting on the point of each one? The light actually only reflects on the blunt one. So now let's try this again with a chant screw. So this has a trocar tip, and this drills its way through the bone. We would like to do this. Would you like to try? Yes. So again, apply the drill bit to the drill. Okay. Now, there you have your bone. Careful. Okay, now try to support your drill sleeve and go through the first cortex. Okay, now let go of the sleeve and go all the way through. Okay, let's measure this. Look at it yourself. You think you did a good job?
Not really.
I think it is a pretty good job, really? Because you only went through about 3 to 4 millimeters. And considering that this is a trocar tip, which is not meant to be left in the bone, it is used as a provisional fixation, I think you did a very good job. We have a second model in this experiment which represents the soft tissue. Now the soft tissue will give a little way, which is supposed to represent the realistic situation in your operating room. You can now repeat the exercise on this model. So now let us discuss the results of this exercise and what you can learn.
In the online faculty support packages, you can find faculty guides for each station and, where appropriate, topics for discussion and frequently asked questions. In case of questions, please send an email to templates@aotrauma.org.